Today on the Dr. Steve Show, having problems with leg cramps? It could be varicose veins even though you don't see them. Treating them could save your life, and there's a new way to do it.
This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for joining me today. We're going to feel a lot better and be a whole lot smarter after today's show. Up front, do you ever wake up with terrible cramps in your leg? What about leg pain, fatigue, or even varicose veins? Well, I've got just the guy to fix all that for you. I want to welcome Dr. David Gruener and one of his patients, Danielle Holland. Good to see you guys.
Thank you.
Hi.
So Dr. Gruener, talk to me about leg cramps. When someone comes into you and they're complaining of leg cramps, what do you see is going on a lot of the time?
Well, you really have to speak with the patient in detail about their symptoms because there's three main causes of leg cramps. In younger patients like Danielle, there's two main causes: nerve pain and typically vein pain, which was previously undiagnosed in the general population.
So she had vein pain is what was causing hers, and she didn't have any bulging or ropey veins, which can happen sometimes, right?
Correct. And you really have to, question the patient in detail. And most patients that come in of their own accord come in because of varicose veins, but a large portion of patients like Danielle have venous insufficiency, which is malfunctioning veins without ever having any cosmetic disturbance at all.
So you diagnosed that with an ultrasound in your office?
Correct.
Okay, so Danielle, what kinds of symptoms were you feeling? And when you had those, were you surprised when you were told it was your veins?
I was absolutely surprised. I thought it was because I was working out too hard at the gym and, not stretching enough. So what would happen is, like, I would get cramps in the back of my calf. I would get, my foot would go to sleep and cramp up a lot. And Charlie horses more often than, it was just happening too much, so I was concerned.
So what did you do for Danielle, Dr. Gruener, that made her so much better?
We did a procedure called the no-knife endovenous ablation, which is basically a modification of the most common form of ablation using a laser. The main difference with the procedure I do is we don't use a sheath, which is the customary way of getting the laser into the vein. The sheath requires an incision, from anywhere from 2 to 10 millimeters. And on a patient like Danielle with a darker skin tone, that can lead to a pretty disfiguring scar. So the procedure I do just uses a needle. The laser catheter fits through the needle. It's no larger than a needle used to draw blood. And we basically eliminate the need for an incision altogether.
So basically the days of vein stripping where doctors would go in, it would basically be a surgical procedure, are over. It's done with a laser through a needle, a thin fiber. What was it like for you when you had the procedure done, Danielle? I mean, did it hurt? How long did it take?
Not at all. I mean, I actually did it on a lunch hour, believe it or not. I was surprised at how painless it was. So yeah, it was just, I felt a few needles just to, to
numb the area.
Numb the area.
Right.
And after that, it was pretty much over. It didn't take, 15, 20 minutes, if that long. I was really surprised at how simple it was.
Now she didn't have any scarring, which could be a risk, right, for people with darker skin types.
Correct.
So talk to me about that.
So the main benefit of the procedure that I do is basically lack of scarring, and particularly in patients with darker skin tones who are prone to hypertrophic scarring, as well as less trauma to more high-risk patients like people on Coumadin or people that already have ulcers and skin changes that can't take another skin incision. So for those patients, this procedure is ideal.
Right. Now you do it with a very, very small needle, correct?
A 19-gauge needle.
Right.
So the laser catheter fits through that, and that's typically the same size as the needle used to place an IV or to draw blood. It's no bigger than that.
Right. So very, very simple. Danielle, how do you feel now? Have you had any problems since?
No, it's great, and I was glad that there was no bruising afterwards. I expected so much more, and I was pleasantly surprised with how it turned out.
All right, Dr. Gruener and Danielle, thanks so much for coming in. Some great information. Really appreciate it.
Appreciate it.
Thank you.